Hello, I can't.
Can we stop sharing, please? So good afternoon, everyone. I'm Dr. Albina Abbas, the Director of Academics for all the online programs at AAFT. Welcome to our special webinar on skills and qualities for success in hospital management, presented by AAFT Online. Now, thank you for joining us today, whether you are exploring opportunities to enhance your career in hospital management or simply eager to learn more about this dynamic field, you're at the right place. Before we begin, please ensure your microphones are muted. Feel free to post any questions you might have in the chat box or in the Q&A section right at the bottom of the screen. Now, it is my honor and privilege to introduce our distinguished guest speaker for today, Dr. Niharica Raizada. Dr. Niharica Raizada is not just a pioneer in her field, but a beacon of knowledge and innovation in specialized interventional, surgical, and clinical cardiology. Currently, she is leading the future of cardiology as the head of clinical research at the Asian Heart Institute of Research Center. Her illustrious career has taken her across various prestigious roles, including the international head at RG Stone Urology and Laparoscopy Hospital and a medical writer at Johnson & Johnson. Dr. Raizada's expertise also extends to her roles as an ambassador to the American Heart Association and a spokesperson for the British Lung Foundation. Her insights today will undoubtedly enlighten us on the intricacies of hospital management and the critical role of specialized healthcare services. So I would request Dr. Kirti to please share the screen so that we can announce the award that we have today for Dr. Raizada. So, and before we dive into Dr. Raizada's presentation, we have a very, very special moment to commemorate her outstanding contributions to the healthcare sector. And I'm thrilled to announce that Dr. Raizada is the recipient of this year's Award of Excellence for Outstanding Contribution to the Health Sector. Congratulations, Dr. Raizada. Your pioneering work continues to inspire and make a significant impact on the lives of many. So without further ado, I invite Dr. Raizada to share her valuable insights with us. And Dr. Raizada, the virtual floor is all yours.
Thank you. Thank you, Dr. Albina. What a wonderful introduction. And I feel so honored to be able to this award for excellence. I don't think I'm worthy to have it yet, but I definitely know that in due course time, when a very, very important dream of mine gets established, then I think I could be in the running for it. So because I'm establishing an institution myself, and at that time, yes, at that time when my brainchild is going to be out in the open, then I think definitely I can be in the run for it. So much I'm humbled by this award. So without further ado, good afternoon, everyone hearing me. I believe this is a webinar that potentially even crosses, but definitely pan and very happy to be invited and to participate with all of you. So today's subject and talk going to be on success in hospital.
So, sorry to interrupt you, Dr. Raizada. Your voice is cracking. I mean, your bandwidth seems to be low. If you want to shift the Wi-Fi.
Okay. This is the best connection I'm going to get as well.
All right.
This is the absolute best I'm going to be able to. Somehow I have to up my networking, I think. Because everywhere I face this problem. Is it all now? Is it better now, or is it still breaking?
It is still breaking, actually.
I seem to have been logged out.
Actually, your video is stuck for me.
Hello, can you hear me?
Yes, yes, we can hear you. Yeah, yeah. So I think she's facing some issues with her bandwidth. So she'll be back here soon. So till that time, if you want to put across any kind of questions, yes, the audio was not right. Dr. Bajesh, you've very rightly said that the audio was not good. Maybe her bandwidth or there's some network issue. So she'll be joining back again with a better network. And till then, if you have any questions in mind, you can always put it in the Q&A box, which is located right at the bottom of your screen. So network issues are really, you can't avoid them at times. So we're just waiting for her to join in. In the meanwhile, I would request Dr. Kirti, who is our mentor for hospital management, to just give a brief about the program that we have and how hospital management works.
Hello, everyone. Good afternoon, all of you. Thank you for being here. Thank you for being part of this webinar. So until Dr. Niharica joins, yeah, she's joined back. Let's see.
Can you hear me? Can you hear me better now?
We can hear you, Dr.
Yes,
Niharica.
yes, we can hear you. Yeah. Yes,
Good.
yes, we
So-
can hear you. Great.
So should
Yeah.
I continue?
Yes, please. Yes, yes, please go ahead.
Okay, so just to reinstate, yes. So we're going to be discussing skills and qualities for success in hospital management. I think it's very important for all members of the hospital to actually have a basic understanding about, what it takes to truly be a part of a co-working space like a hospital. So let me tell you a little bit about my experiences so far and the institutions that I've been a part of. I'm a European baccalaureate graduate, and I was born in a very small Grand Duchy of Europe, which is called Luxembourg. It's a monarchy. It is still has a duke at the head of the country, even though we have a prime minister with executive powers. It's a very small country, and I think because it's a small country, the competition is there, but it's not as much, and in comparison to a country like India. And so somebody who's really out there, motivated, willing to learn, and really understand the walks of life by doing actual, live internships and practical sessions. I think Luxembourg country is an extremely amazing place to push your limits, to be very honest. And that's where I started my interaction with hospitals. We have a government and private combined hospital called the Central Hospital of Luxembourg. And I started working there the moment I could. There is an age limit, or an age requirement to work in a hospital. And that has always been 18 years old. I always wanted to work in the hospital earlier, but before I could get to the hospital, I used to work in small veterinary clinics and dental clinics. But then as I turned 18, I got my first job, and that job was as I would say an occupational therapist, or a person who would actually be transporting patients from OT back to ward and, greeting and meeting patients. So it was a sort of overall role. And I can't tell you how instrumental that role has been in my understanding of what hospital management was, because I must have covered every floor, every department, just by transporting people from here to there and meeting and greeting patients from, everywhere who were coming and being admitted or even staying at the OPD. So that was the beginning of my journey. And then I shifted to London, where I started my MBBS and BSc and masters. And there were many hospitals associated with Imperial College, two of which were very close to me. And that was St. Mary's Hospital and Hammersmith Hospital. So this gave me insight into the British and the National Health Services. So again, a very different perspective from what I have experienced in Luxembourg, because that's very European. And the national health system is very, very different. The National Health Services of Britain. But great experience with my hospital, and that's where I learned the majority of my hospital work. And then I traveled with a scholarship to Johns Hopkins in Maryland, Baltimore. And again, I learned the American systems of how hospitals were run. And again, a very insightful experience for me. In between, I managed to also see how hospitals function in Zurich, in Switzerland, high-end, latest technologies, incredible genetics department. I mean, back in the day, like, they were the best at what they were doing with regards to genetics. And I'm a very keen student of genetics. So it was really nice to see their equipment, their machinery, and in general, because the Germans and the Swiss are very good with their methodology, are very good with their fine tuning, are very good with their, execution of management, I would say. I think the best. The French are wonderful as well, but I think the Germans surpass them, and the Swiss also. And in terms of the British and the Americans, I think the Americans are very innovative. They ideate a lot, they brainstorm a lot, they're very futuristic. And the British, I think they're very educationally, I think they drilled into my brain a lot of aspects of healthcare, which maybe I would never have actually instilled within me. So great value system from Britain. So with this institutional experience, I came to India, and I had the privilege of working at Indraprastha Apollo Hospital in Delhi. I did many internships there with both cardiologists and neurosurgeons, and I also worked at Johnson & Johnson. I was teaching a research-oriented course where people would learn how to write clinical and interventional and surgical medical research papers, and also understand what it meant to use new technologies for surgery. So that was a really interesting experience at Johnson & Johnson. I had a wonderful time there. And finally, I also got, and whilst I was trying to get to my end destination, which has always been a super specialized cardiology institution, I worked at RG Stone, and I would always complain and tell them I'm in the wrong department because cardiology is my department and I was stuck in urology, but it was an incredible experience because I learned about lasers. I did a lot of surgical interventions there as an assistant, and I learned a lot about catheterizations. And I think today, the institution that I'm going to be founding is based on the fact that I actually went to a laparoscopic laser catheter oriented focused hospital. So all in all, I think, but my end destination has always been a super specialized hospital. And Dr. Ramakant Panda is my chief, is my boss, my mentor at Asian Heart Institute. And he accepted me to head his research center. And together with him and his staff and many people from the departments at our Asian Heart Institute, I've been working a lot in research and, trying to write papers. In general, just trying to understand how we can further the understanding of cardiac principles within India. So that's my basic experience. I've been a spokesperson for British Heart Foundation, Pulmonary Hypertension Association, mainly cardiology-based subjects, because that's very dear to my heart and soul. I've always specialized in cardiology, so that's always been my interest. So that's a little bit about my background, and it just tells you that, you know, I would urge everyone to try and experience internships and small associations and all these placements that you can have all over the world, because it gives you huge experience. So from the little that I can tell you, I mean, I've had the good fortune of belonging to certain countries, and that's why I've had the opportunity. But I've also made these opportunities for myself. I would seek these opportunities. They didn't come to me in my lap. They were sought. They were really, I went after them. I actually applied to Zurich. I applied to Luxembourg's hospital. I applied to Johns Hopkins. I just didn't get them, you know? So you can make an effort and you can try and understand how you can go to the institutions of your dream, you know? So these were the institutions of my dreams, and I was lucky enough to be, you know, accepted. So let's start with what the objectives are for this webinar. So skills and qualities for successful hospital management. At the end of this, I hope you understand what the definition of hospital management is in a nutshell. And also, you know, really kind of get a feel for the core skills. According to me, I'm going to be very personal when I'm going to be explaining this, you know, PPT, because I have over the course of all these years that I've worked in various hospitals, picked up on a couple of skills that I think are really important. So, and then we have understanding about strategic planning and business acumen. I think that's very important if you want to do management. I think business understanding is very important. A little bit of healthcare knowledge that I feel you should know. I mean, everybody has to know these basics. Talk a little bit about interpersonal qualities. Then I want to also go through how I used to recruit my staff and my HR skills, or my understanding about how people should be recruited. I won't go too deep into ethical and legal considerations, because that's a very broad and big subject on its own. But I'll give you an overview about what I think about how the institutional review board should be, you know, set up. And then we'll talk a little bit about what's happening in the future, what are these new advanced techniques, and how technology integration can be used in hospital management, because that's the future. And of course, as I've always said, you know, you are what you seek, you know, you are what you can actually aim for. So personal development and continuous learning has been a part of my life, and I hope to impart that to you. So what is the actual definition of hospital management? So I've placed here that's effective hospital management ensures seamless coordination of resources, personnel, processes to provide optimal care for patients. It's a very summarized and a very small definition, because as a whole, there are so many layers to the way a hospital can function. So, but the basic ground rule is that all departments and all aspects of the hospital should be able to function seamlessly together. They have to be able to come together, and that's very important. So if we could just go to the hospital management hierarchy slide. I mean, there's obviously a lot of levels, right? Now, in certain institutions, right, I can tell you at Asian Heart, we definitely have a hierarchy. You know, Dr. Panda is the mentor of them all. And then we have the middle level and the lower level, which is very clearly defined. But there are certain hospitals where I think there's a lot of, you know, blurred lines with regards to the way power shifting happens. And I think those are the best kinds, to be very honest with you, because in a hierarchical system, you know, people are not able to work in groups as effectively as they would want. So obviously you have the, you know, the dean of the hospital administrators who are, you know, at the top managerial level, who really boss everybody around and tell people what to do, what not to do, and how to do it. But I think a lot of times, you know, there are students, there are, you know, nursing staff there are physician assistants who really do have ground knowledge about what is happening. And I feel that some of their ideas, and me being the way I have been always, I always want them to have an open discussion and a communication with me, because I need to know about what's happening on the ground level. So for me, it's really important that these lines are blurred with regards to the way people interact from the lower, middle, and higher level. So especially when it comes to nurses and physician assistants, these two are, for me, beyond, I mean, the doctor's clinical decision may be more important, but the nurses and the physician assistants' knowledge and general understanding about what is happening on a day-to-day routine in hospital, for me, is prime. So I especially would like to, give importance to the nursing and the physician assistants part. And the students, it depends what kind of student they are, but if they're the learning kinds and the motivated kinds and the enthusiastic kinds, they can also be a huge asset to understanding how, for example, information can be gathered and then actually implemented into the structuring and the whole execution of the hospital management system. This other slide, I really like the slide because it divided up the hospital management system into these 4 branches, which I found really interesting, So you have this information services department, you have your therapeutic services department, you have your diagnostic services and your support systems. And I thought that was a really nice way of basically putting out how hospital structure and management is basically divided up in, because I think this covers everything. So I thought this was a really nice summary slide, and that's why I've put this in, because you can clearly divide every staff member according to the services that they provide. And especially when you're building hospital management systems, or when you're trying to integrate information all into one with the electronic medical record systems, I think this would be my, feed into the system to tell them that, I would like to divide it up in this way. So that's why I've kept it simplified like this, because I really like this 4 services division. So I see it like this, because I think a lot of people who do research, right, they're very mathematically driven. And when we're trying to do algorithms to, kind of now with this new data-driven concept and AI-driven medical treatments, we all just want things to be simplified, and I know it's not nice to say this, but things to be boxed, in certain aspects. Like administratively, you do need to put certain things in a box. You can't be too creative. So I really like this summary slide, and so that's why I put it out there. So now let's talk about what I feel are the core skills in hospital management. So in hospital making, in hospital scenarios, I think the thing that is the most important is to make things affordable for people, and you and your skill in trying to achieve that, because everybody in somehow, especially in India, I feel there's this race to be able to get targets, and there's this huge aspect of money, right? But in a good hospital management system, I think everybody's mindset should be changed on those lines. And that's why I've kept that as my very first skill. And that is to think in a way that you have to make things affordable and palatable and, acceptable by the people. You don't want to put a burden. So I think your general stance as a person, whatever division or whatever whatever place you are in the hospital, whatever system or hierarchical system you are in, you have to make in your mind think that whatever we're doing this so that it's accessible and affordable for the patient. So that's a skill that I want to put up there. I don't know if it can be called a skill, but it's a mindset, So that mindset is something that I really feel in many hospitals in India should change. And that's why I've kept that as my number 1 mindset skill, Then I feel people should be able to, in their minds, right? They should be able to put together all the platforms. You should understand that you're not looking at things singular. You're looking at things aligned. You're looking at things on a single standardized platform. So that's how you're actually going to be able to see things globally, So understanding how you can align platforms is a very important skill, especially when you're looking at things from an overview and a bird's eye view perspective. So I think in your mind, knowing how to align is very important. In today's times, if you are not like equipped to absorb technology as fast as it's changing, then something's not right with you. You have to be somebody who has to keep yourself up to date. And I mean that with all my heart, because I think in the next, not even 25 years, but in the next 5 years, the level of technology upgrade that every single hospital is going to have to take, I mean, we're not talking about, to just tier 1. I'm talking about even up to the rural aspects of hospitals. Technology is going to come in like a big whack. And you have to, as a person, be ready to accept that technological change. So I've kept that as a skill as well, to be able to learn the ability to accept these new technologies. I think the adoption of this technological advance is very, very important in general. So I am the kind of person who would want a super specialized hospital for cancer, super specialized hospital for cardiology, super specialized hospital for radiology, because that's my approach to treatment. I think that though I'm a very multifaceted person overall, and I think 1,000,001 things in my life, but when it comes to medicine, I truly feel focus and specialization in a particular area. I think it gets better work done, and I think the results are better. So singular focus, singular focus. And it's coming from a girl who has multiple focus. So please don't quote me on this at all, because I think I'm a very bad example to kind of even advocate singular focus, but I am still saying this. Singular focus is a very important skill. I think you can just achieve a lot more. And I think even it can be very beneficial for patients overall. Of course, I think, there is now a CSR rule in India. We have to do charity. We have to think from a karmic perspective. We have to be able to understand hospital management, not just, like I said before, from a money-making sort of angle, but also from a philanthropic angle, which I think we need to advocate more and more, because it's just important. Now, from a business point of view, from CEO and CFO, I might get fired. But the point is that I know that volumes in India will always give you the numbers you need. So you have to have the core skill of being able to think from a karmic and philanthropic baseline. You have to think like that. And obviously, I mean, it goes without saying, you have to ideate, you have to brainstorm, you have to be able to create new ideas all the time. So if you're not somebody who is creative, in any field, you will always find it difficult and you will always be limited. So upping your creative skills and your creative aspects is very important. So I just want to tell you about a couple of people that I really admire. I know Mr. Abhay Soy for now maybe 10 years, and I can't tell you. So I want to just go to the case in point now. I know Abhay Soy now for a very long time. The next slide, please. So he has transformed the way healthcare is in Mumbai, in general, in India. But that man has truly used all his skills to I think transform and completely turn around healthcare. So I would really urge you to look up and read up about Mr. Abhay Soy. He's an inspiration to me. And I knew him when he was about to start his journey, and now I've seen the results that he's kind of done. So urge you to have a look at his biodata and his biography and the work that he's done. Dr. Devi Shetty. Dr. Devi Shetty, incredible work. I mean, without being biased, obviously he's a cardiothoracic surgeon, and I love cardiothoracic surgeons, but he has done incredible work for Narayana Hridayalaya. So I think another great example to follow, and a great mind to read up on and to associate yourself with if you ever get a chance. Now, Dr. Kishore Pujari, he's doing some good work at Gitanjali Medical College Hospital, which is also nice. You can have a look at that. And you can have a look at the way the Apollo hospitals have kind of, spread out. these are a couple of case in points. I find these hospitals and these people to be very interesting, and I think you could look them up, and if you ever get a chance, meet them, have a discussion with them, because I think they have a lot of great insights to give you especially with regards to hospital management. Now, this is not my forte, as you would have noticed by now. Strategic planning, business acumen, financial management, operational efficiency, and all that is not personally my cup of tea, but very important for hospital management. So, and this is basically dogma. So let's start talking about financial management. So obviously, budgeting, very important. You have to know and develop a comprehensive annual budget for the whole hospital, understand revenue projections, because that's the only way your stakeholders are actually going to ever give you money for expansion. So keep everything in check. Just don't be greedy. That's the whole point. Just don't be greedy. I think the bottom line with this kind of slide is it's important to have a very good financial planning for your system to be able to expand, but it should be based on innovation rather than that's the underlining thing that I would like to say. Obviously, you have to keep in mind your operating expenses, capital expenses, contingencies, keep all that in mind. And obviously monitor obviously all the financial performances you get every quarter and then yearly. So understand the revenue cycle management. And this is all basically information I think that you can go through even on your own, but you have to be able to understand how to, be timely and organized with regards to making sure your billing is correct, your coding is correct, and obviously if you don't get your payments, your hospital won't run. So keeping your collections in check from time to time is very important. I mean, cost control, I personally think that with the right kind of clinical services and with the right kind of clinical management, you get good financial management. I think they will go hand in hand. So you need to really have incredible staff understanding the clinical financial aspect. So that's when it kind of goes back to your when it comes to your suppliers and your and all the vendors that you deal with, you know that on a clinical level, you've made all your planning so efficient that there's not going to be any problems with regards to having too much staff or too much too much supplies or too little supplies. So I think clinical financial stability is also very important to be able to get financial stability with regards to cost control. Cash flow management. Yeah, I mean, it's a very important billing aspect, and you have to be able to manage and pay all your staff effectively and know that your hospital has enough liquidity. And like I said, this is not my forte, but very important aspect of financial management, cash flow management. Reporting in hospital settings is the most important. So financial reporting to make sure that you have everything written down and reports are there for future auditing experiences. That's very important to have. Now this is something that I'm very interested in, and that's investment management. So you have to keep understanding your board of directors or your stakeholders' vision and bring that back into your financial modeling all the time. So I think continuous meetings with your stakeholders and board of directors to understand what they have in mind for the hospital, especially if you're a venture capitalist funded hospital. People who are privately funded, I mean, they don't have that much jawabdari nahi hoti zyada, but in general, like when you're dealing with a lot of stakeholders and stuff. So I think understanding investment management is very important and critical to financial management. Compliance, it goes without saying. I mean, I think hospitals have the most rigorous compliance practices. So very important again, and it directly affects your financial management, because if there are any errors in compliance, so you can get a lot of fines, and so you have to avoid all legal and all penalties that could lead to problems in the future. Use technology. I mean, nowadays it's all about technology. Like I said, that's a skill. You need to know which is the new system, which is the new computer, which is the new device, which you need to know that. I mean, technology, and that's why I used it as a skill initially, because you need to be able to be technologically skilled to be able to run any institution nowadays. Of course, cost accounting is there, and like I said, continuous improvement, that goes without saying. Now, I really like this slide. You know why I like the slide? Because it's obviously come from a Japanese person, because you have your Gemba walks and you have your Kaizen events. Now, I don't know how many out there of you know, but Kaizen means a continuous improvement in Japanese. Like, that's what it actually stands for. Like, it's divided up into two words, Kai and Zen, and it stands for continuous improvement. So I just want you to go through in general the slide on your own, but the two aspects that I want to take out of this slide is the Gemba walks and the Kaizen events. Now, the Gemba walks and the Kaizen events, why do I want to specifically harper on that? Is because I feel that people should crosstalk. In all great hospitals, the billing department knows the ward guys, the OT guys knows the radiology guys. In a good institution, everybody is cross-talking, and they're talking all in favor of the institution. So that is the most important. Like, I think that crosstalk between departments is very, very essential. And Gemba walks is a really nice way of putting things. If you don't go to the place where you know your things are happening, you won't understand the intricacies of that environment. So Gemba means to actually be in the place that you're working. So for example, the guy sitting in the billing department gets told that this is the bill that's been made, right? But it doesn't take that much time to go and check once. It doesn't have to be every time, but it doesn't take too much time to go and check once when you're in the actual OT, or when you're in the actual ward, or when you're in the ICU. If all that is being billed or all that is being mentioned is actually being done. Like, I think you have to take an effort and go into other people's territories, make yourself acquainted with those kind of systems as well. So Kaizen events and Gemba walks are two aspects I want to take out from this slide. The rest has all been, the rest is self-explanatory. Like I said before, you have to standardize processes. You have to, have a daily management system. Connectivity is really important. Value stream mapping, they write here that it's a conduct through a thorough analysis of the patient journey from admission to discharge. I think it's really important to from time to time to just keep seeing that journey within your managerial systems, just to be able to get a hold. But once you've seen it once, twice, or three times, you get a good feel for it. So that's value stream mapping for you. And obviously keeping your staff happy and getting the best out of them in terms of operational excellence. That really takes the head of department's best acumen to get it out all their staff. So, but definitely want to focus on Kaizen events and Gemba walks. Very, very important. Continuous improvement, and go to the place where you are actually, if you're billing something, see what you're billing. Go and see what you're doing. It's really important. So the third part about the strategic planning and business acumen was strategic partnerships and growth. So I want to take a few examples about what's happening and how I see healthcare revolutionizing and improving. That continuous improvement aspect only comes with partnerships. So IIT Kanpur and the Blockchain Foundation has given $150,000 to improve healthcare systems in UP, and I think that's a phenomenal partnership that's been created. And these are the things that actually, you have to look outward. Like, though you have to administratively be boxed because you have to keep things contained, for growth and for expansion, you have to always look outwards. And so I've kept these three examples. Please look at them. GenWorks and Comment. So Comment is obviously Chinese. We can't really mention too much about if partnership should or should not be, but I'm a very inclusive person, and I would like to say that all partnerships are welcome as long as it's in the direction for growth, expansion, and for the correct reasons. So no thing is collaboration, no partnership, no strategic investment is a bad thing, and as long as the motivation and the end result is something which is patient driven and hospital driven rather than anything else. And then you can have a look at the Dream folks and the Healthians, which are collaborating. They're doing some great work together as well. So people are now developing new apps. You have these diagnostic centers which have incredible parameters which are being studied, and they're just combining their efforts. What your hospital cannot do in-house, you need to find someone doing it better. Like I said, singular focus. Those guys who are singularly focused at doing things better, join hands with them, combine them, bring them into your system, bring them into your portfolio. You're only going to get a better output. So it's always nice to be able to do that. So now, a little bit about basic healthcare knowledge, which I feel is very essential for anyone who's trying to understand hospital management, regulations, and compliance. Without that, you're not going to be able to even put one brick and actually lay down the foundation for your hospital. So regulations and compliance, I think, is the most important aspect of actual hospital management. Clinical workflows is what happens on a day-to-day basis. So you should be absolutely in tune with that workflow. And obviously, you can't just give service. You have to give service with safety and with quality. These are very important words, quality and safety. You have to give your patient, you don't want your patient coming in and getting a MRSA because your systems are not in place, because there's no hygiene, because there's no quality in your caregiving delivery. So quality and safety goes hand in hand. So something very important, I feel, every hospital management person needs to know. So I've broken it down according to the few places where I think you should know the systems of. So in India, you have to know about the Drugs and Cosmetics Act of 1940. You have to understand the Clinical Establishment Act. You have to understand the Medical Devices Rules, 2017 Implementation Act. And you have to understand the National Health Policy. This is a lot to read, a lot to go through, but, that's hospital management for you. You have to read a lot and you have to know a lot. So make sure you're very familiar with the Drugs and Cosmetics Act, with the Clinical Establishment Act, with the Medical Devices Rules and Implementation, National Health Policies. Any new government directives that come out, make sure you get a notification about it. So, switch over, make your Instagram, Facebook government savvy, so all your new updates are coming on a regular basis. Integrate your entertainment and your workforces together and make sure you're getting all the latest government directives, and they're all coming up as notifications as any other aspect would in your life. In the US, you have to be well acquainted with the FDA, because that's how everything functions there. You have to know the Health Insurance Portability and Accountability Act. The Affordable Care Act is something you have to look into. The Centers for Medicare and Medicaid Services. I mean, you need to be able to understand what they are actually saying to be able to run your hospital effectively in the States. So very important things to look out for. In the UK, you have to obviously understand the whole workings of the National Health Services, the Medicines and Healthcare Products Regulatory Agency, and you have to, put a little bit of emphasis on the Care Quality Commission. And in Europe, overall, you have the European Health Insurance Policy, which is really important to learn. You have the General Data Protection Regulation, you have the European Medicines Agency, and the Medical Device Regulation Body, which are all very important, and they will all be integrated into your hospital. And so it is very important from a managerial perspective for you to be able to understand. I just want to go through a couple of the act. So the Clinical Establishments Act, it regulates the operation and standards of clinical establishments in India. So without that, you really can't do much. And it's very important to understand what that act defines and the scope of work that it actually encompasses. Drug and Cosmetics Act regulates the import, the manufacturing, distribution, and sale of drugs, cosmetics, and medical devices in India. So very important for your pharmacy in particular, but in general as well. The Medical Council of India is the overall governing body and important for how practice is done in India. So your doctor's licensing and all that. So Food and Safety Standards Act regulates safety standards in India. And it also gives you that quality. You want to go for the quality. I mean, it kind of overlays the quality aspect of food, which is, I think, the most important. I think in the wards, I think it's the hygiene, the cleanliness, the food. All of these things make a huge impact on how the wards are run. Biomedical waste management rules mandates the proper segregation, collection, treatment, disposal of biomedical waste generated in health facilities. Very important act to understand because you're dealing with a lot of waste on a day-to-day basis. National Accreditation Board for Hospitals and Healthcare Providers, NABH, can get that accreditation for your hospital, and therefore you will be in the ranking systems, and then you will get awards, like I got one today. And so you need to be nationally accredited if you want to be able to get the awards. It's very important. So but I mean, also if you want to be audited well, so it keeps a standardized check on if everybody's doing things, in the right way. Telemedicine practice guidelines. This is new, obviously. Telemedicine has recently been introduced into the hospital environment, and I think this guideline is now very important, and it's going to be even more important going forward because I think more and more telemedicine is going to take over a huge part of how clinical decision making is going to happen. Clinical trials regulations is my particular area of focus. I run a lot of clinical trials. I do a lot of clinical trials, and so it's very important to familiarize yourself with the IFC, GHP concepts and all of that. Information Technology Act is also very important, and the National Health Policy, make sure you keep yourself updated with that. This is the basic clinical force, a very simplified clinical force. I had a lot of slide options, but I mean, in basic terms, there is a lot that happens within the hospital. Obviously, there's the admission, then there's the whole processing of patients' clinical history, all the examinations, the diagnostics, the lab work, then admission, not admission in terms of if it's going to be just OPD or IPD, and then IPD, and then surgical, non-surgical, medical only, all of that. I mean, it's a huge list, but just familiarize yourself with the clinical workflow. That's the point about the slide. You have to understand from A to B, or A to Z rather, what is the clinical line of what a patient goes through from admission all the way to discharge, bypassing the finance department. That clearly I have a hate and love relationship with the finance department, but it is a very important aspect of your hospital. Quality Council of India, and like I said, NABH, very important to just make sure that you're providing quality care to your patients. So now let's move on to, this is very personal to me. I mean, the interpersonal qualities for effective management. It's very important to be clear and precise. A lot of times I find people are not clear and not precise. They're very vague and they're very imprecise. In medicine, that doesn't work. You see, if I cut even 0.0005 millimeters to the right, it affects a lot. So similarly, as the surgeon is very clear with his blade, you have to be very clear with your thoughts and your words. So giving people clear instructions and giving them, effective communication, I think a lot of people lack that. So a lot of times I feel we should have seminars and workshops within the hospitals. And it's very important. I mean, obviously time is a factor, but you should for every quarter, I think it's very important to discuss what has happened in this quarter and what can we improve based on how people have been communicating and how clearly and precisely they've been communicating. So I keeping reports about that is very important, and keeping tabs on that is very important. Emotional intelligence to me, I think, ranks number one with a person like me. Understanding, the kind of people that are in your team, how to deal with them. You're going to have different personalities. So I think emotional intelligence really helps in giving your group the right environment to be able to bring the best out of them. So Emotional intelligence is a very important interpersonal skill. And it truly brings out people from their shell. And it also gives people that empathy to be able to feel appreciated and to actually, you don't know. If you're like, I have this habit of, and this is not a good habit, I have a habit of constantly, I'm very angry and raging at my staff all the time because things are not done correctly. But the moment you change that attitude and you make it into more pleasant or happy, and you make the other person feel more appreciated, I can guarantee you there's going to be better work output. But from time to time in stressful situations, it's very difficult to do. But keep your emotional intelligence as an interpersonal quality. Really, really keep working on that. It's very important. Obviously, conflict resolution, extremely important because each department's egos are very, very big. The radiology department, the billing department, the administrative department, which actually runs the hospital, they don't align, they never align. They always have some clashes, but it's important to have conflict resolution is very important because you're working as equals, like I said, and hospital work, is a community service at its best, and it's the most respected. So you really should have a lot of patience and a lot of selflessness. I think these are two things that have helped me a lot, having a lot of patience with people who consistently don't communicate with me effectively. And I'm just listening to them and I'm telling them, okay, Niharica, just be patient, because at some point you will be able to guide them on how to be able to give correct and concise communication and get the work done accordingly. So patience is a very important aspect. Selflessness, not many people have it, but if you can have it, it's great. I now want to tell you a little bit about how I used to recruit my staff. So I have been on the recruitment side many a times, and I've been fortunate enough that people actually would take my opinion. That matters a lot, because that means your voice actually has credibility. You have to, these are the skills that I look at. So first of all, you get a CV, right? So you're looking at their educational background. Like for me, educational background is the first thing that I look at. Which institutions did they come from? And is it an institution which has standing? Is it reputed? Does it have a ranking? For me, education is very important. So looking at their educational background, I always cipher people based on educational backgrounds. And then I obviously like it when in CVs people write about their alternative skills, because that tells me about the differential processes and their minds and thinking. So I always expect my potential staff to have a very, very well diverse, open, extracurricular body of work. So not just the education, but also the extracurricular aspect. I always look at that very importantly. And I think it's really important, because that tells you as a person what kind of person you're recruiting. I've written age factor here because I have had people at the age of 50 apply for jobs which were meant for students who have just come out of college. But I think, you have to look at what that person is bringing with their 25 years of work experience. So age factor for me is also quite important. At times, I have recruited people who are a little older and maybe not suitable for that particular positioning, just because the group dynamics of that particular team is younger. But sometimes when you get in a couple of people with more mature experience, it can really help in a lot of aspects. So age factor is very important, because without saying much, I mean, not to diss or not to say 18-year-olds and 21-year-olds and 23-year-olds don't have it. They do have it, but 50-year-olds have it more. So that's why I've written age factor. International exposure always makes somebody a lot more open to ideas. And since I've also come from so many varied backgrounds, you can understand that when I'm going to be making my institution or founding my institution, it's all that information that I've been collecting from the different management systems that I've been a part of that's going to be helpful, and maybe might help me stand apart from everybody else, because it's important to get international exposure. So I urge all of you students to at least get one internship. It can be anywhere. It can be in Nepal. It can be in Sri Lanka. It can be in Bangladesh. but try to get one international exposure, at least one. If you can't go out, if you can't go to the UK, you can't go to the US, you can't go to Europe, try to go out of the country. It's really, really important. Because I actually, when I people, I give them brownie points to, if they have some international exposure. People don't get the chance. I understand that. It's a matter of visas, it's a matter of money. I understand all of that. But I'm still telling you, you must, even if you can get across the border somehow, you should do it. Obviously, people's motivation and enthusiasm for learning, very, very important. Like I said, I'm not going to go through the ethical and the legal considerations about hospital management because it's a very broad subject. But obviously, you have to understand that, especially when you have a hospital and you have the institutional review board and your ethics committee, there's full, operating a protocol and how it should be established, how it should be done. But it's way beyond the scope of this discussion. But obviously, there's a very strong ethical and legal consideration to take into account when you're talking about hospital management. So now, integrating technology and advanced techniques and the emerging trends, which has everything to do with technology. So in the future, all the medicine that is happening and all the information that is even going to get to the patient is going to have a predecessor of data-driven analytics. Because especially for the older hospitals who are 10, 20, 25 years old, they have data which is golden. It is so amazing to be able to leverage that data and make clinical decisions and also improve the status of your hospital. So data-driven decision-making is something which I swear by. I think it's a pillar of the way I would talk about hospital management. You need to make sure your data is protected, your data is accessible, your data is properly stored, because it's going to be gold for you going forward. So data, make sure you have it well protected. It has to be as protected as the patient. So leveraging healthcare analytics, informatics, and patient care. Try to incorporate new biotechnology aspects to data construction, data algorithm building. And I'm telling you, technology is going to change the way hospital management is running, the way patients are being treated, and all of that is only going to be possible if you have kept your previous data, that's your clinical records, your electronic medical records, all your patients' information in a concise place and access it so when the time is right. So this is a big problem for me because old hospitals, they have everything in hard copy. They don't have anything in soft copy, and if they have it in soft copy, it's all it's not standardized. So it's very important to standardize all of that. First, you have to get the hard copy into soft copy by doing a lot of scanning. It takes years. It takes up to 3 years to scan data and put it into a readable format. But do it now before it's too late. Or when you start the hospital, make sure that the way you're collecting your data is so well in tune with technology. 50 years from now, not even 25 years, not even 10 years, you have to be able to collect data, and that's all the parameters, be it billing, be it patient related, be it administrative related, be it reporting. Everything should be in a format which you can break down and take bits and parts of it if you want to make data-driven decisions going forward. Obviously, telehealth and remote patient monitoring has its setup. That comes with technology, and there are different ways to be to incorporate that into your hospital. Telehealth and remote patient monitoring is going to become a bigger aspect because I know that a lot of patients aren't physically able to come to hospitals. So I know that going forward, there's going to be a telemedicine department, which I have never heard of in the past. So, telemedicine department is important. Obviously, keeping your electronic health records optimized, very important. And in the future, I'm sure we're going to have small robots in the hospitals collecting data, talking to people, and they're going to come in, plug their USB into our systems, and we're going to be able to get all our data. So we can expect a lot of new changes, and India is a place where if you do it now, we should be doing it now before everybody else. So that's why I put the robotics there. A couple of hospital management systems that you might want to look into: HealthRay, Arogya, HMS Soft Clinic, iMedicare, MokDoc, HMS, eHospital, Oracle Healthcare Cloud, Crelio Health, Live Health, Medicare, Epic Systems Corporation. These are from abroad: Cerner, InterSystems, Systems C Healthcare, Acva Healthcare. They all deal with the hospital operation, the medical side, the financial, administrative, legal, compliance, EHR, OPD, IPD, management, radiology, pharmacy, and laboratory management. I urge people who are doing hospital management to seek out new, what do you call them, new ventures, like new entrepreneurs who are actually coming up with new HMS systems, which are better equipped, better technologically advanced, and more AI savvy. So I personally, right now, as I'm building my institution, I'll tell you about what I'm doing, what institution I'm building. But I'm going out to all sorts of healthcare fairs and startups, entrepreneur fairs who are healthcare driven, and I'm getting their information on what they're doing with regards to HMS systems, because HMS system is going to be your infrastructure on the computer, and that has to be at its optimum. These are two incredible conferences that are going to happen. One in Istanbul, one in Rome. The 7th ICHSM, which is the International Conference on Healthcare Service Management, will happen in Turkey between the 6th and 8th of September. So if you have the money and if your institution wants to send you there, then ask for the sponsorship or ask them to send you, or fly yourself. And then there's the 12th International Conference on Hospital Management and Healthcare happening in Rome on the 12th and 13th of September. Both very beautiful places. I have never been to both, or maybe I've been to Rome, but I have not been to Istanbul. But I would love to go, but I don't know if I would have the time. But keep yourself involved in seminars and workshops and internships, and keep reading books and articles that come up with the new aspects to hospital management. Definitely check out these two conferences then, if you get a chance. These are a couple of books that I have mentioned that you can read. They give you a little bit of information theoretically about what hospital management is all about. And yeah, I've ended this presentation with a quote from April Ko. She's a CEO of a very important mental health institution. And so there's this funny aspect about April Ko. She runs this thing which is a mental facility which actually caters to people who have mental problems. But people say that working under April Ko gives you mental stress. So they say that it's like a double-edged sword. But I like what she's written. It starts with the people, and nothing is more important than the people. Because nowadays the quote is, it starts with the money and nothing is more important than the money. But I would like to go back and say it starts with the people and nothing is more important than the people. So take care of people, and, when you're hiring, hire someone who's better than you, always better than you. I have never hired anyone who's not as good as me or better than me. They've always been incredible. And that's because they'll do a better job. So thank you, April, for being the taskmaster that you are. She's a real taskmaster. Enjoy your course, enjoy everything that you're learning. Hospital management is very dear to my heart. So now I'll tell you a little bit about what I'm doing. I'm building a hospital, which is an interventional radiology specialized hospital, because I feel that going forward, everything is going to be minimally invasive in terms of surgery. And that's why I said that working at RG Stone and understanding catheterizations and lasers, and obviously working in cardiology and understanding the cath lab has been very important for me, because the future of surgery is minimalism, and it's all catheter. So I think together with radiology and catheterizations, we're going to be able to build a new form of medical institution. And being research driven, I am personally curating my HMS system. so that I can have all my parameters from the diagnostic lab, from the laboratory, from the radiology aspect, from the basic clinical note taking that you take, the history taking right at the beginning of the admission. I want to be able to integrate every single parameter. I don't know how many parameters that would be, including, like, I want my file to come as an Excel sheet. And that Excel sheet should have every single parameter of the patient from the admission all the way to his financial billing. So I should know my patient inside out. Obviously, this information cannot go to everybody. Being researchers and being someone who has to look at it globally, get a chance to do it. So we can really see what's happening with patients. But obviously, as long as each department does their bit really, really well, then integrating it for people like us who actually see the overall aspect is very helpful. So I'm doing an interventional radiology center with an Ayurvedic center, with a huge diagnostic center, with a genetic center combined, because I think these are the aspects which are really going to transform medicine in the future. So thank you. I hope I have not bored anybody, or I hope I have not made this too long, or, I hope you understood what I said. I have a habit of talking fast. And
thank you so much. Thank you so much, Dr. Raizada. It was amazing. I mean, that comprehensive and insightful presentation that you had, and your deep understanding of the challenges and innovations in the healthcare management. Truly, it has set a foundation for all the aspiring professionals in this field. So thank you very, very much from the on behalf of the entire AAFT fraternity for joining us today. And based on the expertise and insights shared by Dr. Raizada today, it is clear that the field of hospital management not only requires skilled professionals, but also innovative leaders. So this is where our online diploma in hospital management at AAFT Online steps in, and our program is designed to equip you with the necessary skills and knowledge to excel in managing and leading healthcare facilities. And we focus on practical and real-world applications of management theory in the healthcare setting, and ensuring that you are ready to tackle the challenges highlighted today by Dr. Raizada. And our curriculum covers a wide range of topics, from operational management and patient care, logistics, to regulatory compliance, and everything that Dr. Raizada talked about today. And so much like the remarkable contributions made by Dr. Raizada in her career, this diploma program can also, set the right path for you. So for anything that, if you want to explore this opportunity further, you have all the details on the screen, and you can reach out to our admission counselors, and they'll guide you further. So thank you very much once again, Dr. Raizada. It was a pleasure. It was an honor having you with us today.
Thank you. Thank you so much.